Welcome to this event on the how to sustain local vaccine production for pandemics. Very current and quite important topic.
Dear participants, just 60 years ago, Korea was one of the poorest countries in the world. The health system was similarly underdeveloped. During the course of development, Korea has transitioned into a country with a strong public health system and the bioindustry with the help and support of WHO. The solidarity partnership, however it may be termed, the spirit of cooperation with others, especially in hard times, is deeply embedded not only in Korea's development history, but also in culture and DNA. My country is determined to support the low and the middle income countries in strengthening their biomanufacturing capacities so that we can pave the way toward a safer and more secure world when encountering health crises.
February 2022, WHO designated Korea as the global training hub for biomanufacturing. We call it GTHB. And I believe the designation was largely influenced by the willingness of Korea to materialize the dream of vaccine self-sufficiency in low and middle-income countries. And yes, and you know very well, the workforce training is the key element in realizing the dream. And Korea's first step for the dream in 2022 is providing 4 programs. The first program was done last June for 8 weeks. We thank Asian Development Bank who designed the first course together, and United Arab Institution who operated the training program in Korea. And 33 trainees joined this course during June and July. And from September, the same course is running to additional 27 participants. So the total number would be 60 from 13 Asian countries.
So I'm here to talk about mRNA because if sustainability is the question, mRNA is the answer. And why? Well, you all know COVID happened and a lot of vaccines were being made, and some of them were made with this famous messenger RNA, so we called mRNA. And the big advantage of mRNA is that in theory, you can make many vaccines with it. You can make flu vaccines, possibly, chickenpox vaccines, you can make herpes zoster vaccines, TB vaccines, possibly, even HIV vaccines. You can make a lot. This is where mRNA has a huge advantage. And that is that actually you can produce a lot of mRNA in a very small facility. So about $10 million, $11 million capital expenditures, your CapEx. You can already get a facility. It's about twice the size of this podium. That's all you need. You can produce enough bulk mRNA for about 100 million doses of vaccine per year. Now, this means, however, that you are on a campus where the staff are there, that they're doing other things. Because if your staff are not doing something else, they'll quite soon leave and run away and go and do other stuff. So this is where the biomanufacturing comes in, because you can put mRNA in a facility that's producing biotherapeutics, monoclonal antibodies, maybe even producing veterinary products, even agricultural products. You can put an mRNA facility there. So now the sustainability is going to come from the concept that we've got a low capital expenditure, unlike influenza where it was 50, 60 million for a small facility and $1 billion for a big facility. So sustainability really comes down to the cost of keeping it going and the cost of keeping your staff occupied.
Because ultimately, like you said, if a facility starts up in Africa, for example, and then the product is much more expensive, how would that product really be taken up by countries? We know ministries of finance will probably be like, I'm sorry, it's too expensive. I'm not bringing that product in. So in terms of the market shaping, what we're saying is that we've seen that a lot of African countries, initially the focus was on COVID-19, and we're really encouraging and speaking with the Africa CDC because they're spearheading this initiative for Africa to say, let's look at the disease landscape for Africa. Let's prioritize non-COVID vaccines because this could be where, in terms of your investment, it makes more sense from a short to long-term sustainable perspective. Again, the challenge has to be around the coordination because this is a continental ambition. They've set out about 22 antigens that they want to procure. Can you imagine 22 countries at the same time producing each antigen? So it's that kind of intentionality to say, what does the modeling look like if a North African country, and I'm just extrapolating right now, produces, maybe measles, maybe rubella, what does that mean for the continent? Can they procure? So that level of thinking through, we're looking at it from a Gavi point of view, but Gavi is part of the solution. We're part of the ecosystem around, this long-term plan, because we do believe that from our board signal, there should be some sort of manufacturing capability in Africa. Because what we saw last year, the delays, it's concerning. And as a global community, if we keep talking about equity, equitable access, and then the delay is around manufacturing, then we must find a way to right-side that.
However, there is the potential that the sustainability is going to become compromised by IP in the hands of one or more groups. My traditional approach is, first of all, you try and work around. That's a technical process. You try and work around the patent. If you can't work around the patent, you try and negotiate a license to the patent. If you can't negotiate a license to the patent, you try and seek a compulsory license. And if you can't do that, you infringe and see you in court and to hell with the consequences. That's my typical approach.
For the lawyers in the room, don't listen to the last part. So many thanks. Please join me in saying thank you to our speakers, and we see you upstairs for the reception.